Now, when we think about OCD, I like to think about it in terms of 5 dimensions rather than just obsessions and compulsions. And I'll tell you kind of how I approach this in the office with a patient. The first dimension I think of is contamination. And I think it's helpful to think in these terms because if we link the domain or the dimension, the obsession and compulsion logically follow. So for contamination, we have concerns about dirt or germs, obviously, and the associated compulsions or rituals are generally going to involve washing or showering or cleaning. Now, we also have very, very common the harm-related concerns. These are, as the name suggests, harm-related, and they often result in that repetitive checking behavior. Did I miss something? Did I turn off the stove? Did I lock the doors? Did I close the windows? The next dimension is actually probably among the broadest of the dimensions, and that's the unacceptability. These are what you'll often hear in terms of those intrusive, ego-dystonic thoughts that are aggressive, and it's important to distinguish that these are oftentimes, or generally, very ego-dystonic. So the patient recognizes that these are not thoughts that are consistent with who he or she is. And this often results in a lot of rituals in terms of praying, or in general, we can think about them as goal-directed towards reparation. The next is symmetry, which is going to actually be one of those domains that tends to vary quite a bit in terms of age. So the symmetry concerns tend to be much more common in the younger patients relative to older patients. And there we'll see the associated compulsions in terms of ordering, straightening, repeating, counting. The last is hoarding, which has received a lot of attention, particularly in terms of DSM-5 with regard to hoarding disorder, but oftentimes is seen with OCD. And again, it makes sense in terms of the associated obsession and the associated compulsion. So what I like to do clinically when I'm seeing a patient with OCD is I like to comment, at least in the initial visit, on these 5 domains so that I can get a sense of where the global burden of OCD symptoms tend to be. Now, when we look at the frequency of these symptoms in adults, a little bit different in kids, we see that the 3 most common tend to be checking, washing, or cleaning, and repeating. And again, not surprisingly, when we look at the obsessions, they tend to logically follow. Again, this is why I like to organize it this way hierarchically, because it helps me clinically in terms of tracking symptoms.